Like, I know Gabor was saying that one of the most common mental issues, if you will, that a lot of people were faced with was anxiety. And funny that he said that because one of the most common things that we see in terms of mental, if you will, with the animals was anxiety. And then it's kind of like an unspoken knowledge among the people in the veterinary field that if the dog was anxious, more than likely the people were also anxious, even if they weren't externally showing it. We're like, oh, like more than likely it's actually coming from the people. Like the people were influencing the dog's anxiety.
Welcome to the Two Curious MD podcast. I'm Dr. Ali Ahmed.
And I'm Dr. Soraya Rahman.
With the wisdom from holistic, alternative, and these conventional medicine, we are here to challenge the status quo.
We're curious about the connectivity and complexity between diverse fields of knowledge as they relate to consciousness, chronic illness, mental health, resilience, and beyond.
Learning more about the art and science of healing, or listening to stories of extraordinary healing. You're in the right place. Let's dive in.
Welcome to the Two Curious MDs podcast. I'm Soraya Rahman, your host for today's exploration of the human-animal bond, or are you making your pet sick without knowing it? Today we have with us Nadine Encarnacion, a licensed veterinarian, intuitive strategist, and certified judo coach with a sixth sense for spotting patterns, whether it's in a patient's blood work or someone's shady energy. A judo coach with over 25 years on the mat, she has also spent the last decade in veterinary medicine, completing a rotating internship and now practicing as a fully licensed doctor of veterinary medicine. She's here to educate, not intimidate. She's here to guide pet parents through complex diagnoses while teaching humans how to listen deeper, defend smarter, and avoid conflict before it even starts. Her version of self-defense? Trusting your body, reading a room, and only flipping someone when absolutely necessary. I love that. All heart. With a heart for healing and a mind wired for precision, she blends medical insight with movement, intuition, with instinct, and turns every episode into a masterclass in empowerment, whether you're caring for a pet, a patient, or yourself. If you're ready for embodied leadership, smarter pet care, and someone who teaches both healing and handling, welcome home. It is just an honor to have you on the podcast, Nadine, today. Thank you so, so much. I'm excited because from the first moment I kind of spotted you at this integrative medicine conference, you were standing there in front of the mic asking one of the kind of giants of integrative mental health, Gabor Mate, this question that kind of shook him and made him stop. And you said, we were talking about trauma and you asked, so has anybody looked at the relationship of the animal-human bond when it comes to trauma healing? And what do you know about it? Or something like that. And his immediate response was, yes, of course. It was just like, why wouldn't you even think about it? And I remember talking to you and the confirmation of that also from somebody who's worked in trauma healing with humans for so long, however, was great. However, also, I'm just, in our further conversation, we dug in more and I was like, oh no, you are the specialist here in this human-animal bond. And I'm like, Gabor, thank you, but you don't know enough about this. And I'm really excited because I can't tell you, I've actually met therapists who work in this way, of healing the bond between the human and their animal and how that benefits both. And I've never had a chance to kind of dig down deep into it with somebody coming in from the medicine side of it, the vet medicine side of it. So I'm just excited. And I think our audience is going to love this. And so I just want to ask, you're combining this intuitive sense, this knowledge base of working with animals. And then you're like, wait a second, there's an emotion here. There's an embodied something here. There's a third thing, right? What led you to discovering that? How did you find your way to that place?
Well, it first really started with, my own childhood dog. As me, I over here is clamoring for attention, of course. But as I was in the field and I worked more first as an assistant. Like I literally started from the bottom and then went up to the top as a kennel attendant first, then an assistant, then a senior assistant, even leading like a team of in the ER, and then eventually becoming a doctor. Like there's some things you just start noticing, especially once I became a doctor and started talking to my clients and patients. Like you, as a doctor, you become very good at pattern recognition, or even just as a someone with a history of trauma, for example, it's something that you can become very, really good at because it's, like kind of a self-defense mechanism, if you will. So that combined as with my doctor and clinical senses, it kind of like made me more aware of what was happening with my clients and my patients. And I was noticing a pattern. And so that's why it led me to ask Gabor Mate. And it was so funny because like I would bring this up, but then it seemed like the people I was around with wasn't noticing it. So I was like, am I crazy? Like, is it just me? And then Gabor Mate, before I even like really fully asked him the question, he was the one that was like, oh yeah, like it's funny that you say that you're a vet. He said the stressors of the people or the family are usually the stressors of the animal. And I'm like, it's funny that you say that because that's literally leading to my next question. And it was just very validating for someone also, obviously, like you had said, that someone of his expertise who had, had the research background and everything to be saying that too. And
Yeah.
then, that's how we met. And I just became like, I like love the integrative conference. And I'm just still learning so much about veterinary med and human animal bond and all of that too. So that's where I'm at with that.
Absolutely. What patterns were you noticing? What were these patterns?
If you ask the people who work with it, they'll be like, oh, it just me coincidental, but it just happens so often. It didn't happen all the time, of course, but it's happened so much so that I was starting to notice it. That, let's say, for example, an animal comes in and it's through the ER, and I have to do my physical exam. I worked them up. I did the diagnostics, and I'm like, I'm sorry, unfortunately, your dog has this type of cancer, let's say lymphoma. And they're like, oh, that's funny. I had that cancer. And I'm like, huh? So first I'm like, of course they don't make that face, but then I'm like, oh, so you understand of what it entails, like the chemotherapy, survival, all of that. A little bit different that I have to explain for animals, but still, that sense. Or for example, I've had many cases in which I would, say to the parent, their dog comes in for limping, and I work them up, physical exam, diagnostics, and then end up, I'm like, oh, your dog has a torn CCL, so a cranial cruciate ligament, which is equivalent to an ACL in humans. And then I would describe that to them and tell them, they're like, oh, that's really funny because I tore my ACL. And I'm like, so you kind of have an idea and you'll understand, but like that was happening so much so that I was starting to notice that a lot of times what the family had experienced was the animal will suddenly also experience it. And it wasn't just limited to cancer. It was like, or ligaments. I would see like asthma. I would see like diabetes. Like it was really interesting. And I've never officially written it down, so I don't have numbers. But it was enough for me to be like, oh, this is very interesting. I'm seeing a pattern here.
Yeah, you were curious. You were curious, right? That's the whole thing. It's like, how, we don't read about this. We don't, this is not something I'm sure you're taught, because if you were taught it, it would be in the textbooks and, this would be part of your knowledge base. But it was like something out of your knowledge base that was kind of a correlation happening enough times to where, and these are physical symptoms. These are actual disease processes that are happening in both the animal and human bodies. So that brings us to this kind of idea of integration, right? Integrative. We're in the environment together. The animal and the human are both these biological bodies in a context. But tell me a little bit about what you're noticing, outside of the physical symptoms. Were there others? Were there emotional? Was there kind of, stress or grief or unhealed trauma?
The biggest thing, I can't specifically go into like the trauma portion because I wasn't asking them about, like, oh, to be going through some trauma and grief, all of that, unless they brought it up. But the most common thing, so for example, in the conference, like I know Gabor was saying that one of the most common mental issues, if you will, that a lot of people were faced with was anxiety. And funny that he said that because one of the most common things that we see in terms of mental, if you will, with the animals was anxiety. And then it's kind of like an unspoken knowledge among the people in the veterinary field that if the dog was anxious, more than likely the people were also anxious, even if they weren't externally showing it. We're like, oh, like more than likely it's actually coming from the people. Like the people were influencing the dog's anxiety.
Yeah. Yeah. And, as we know about these conditions, they have to do with what we're exposed to, whether we're talking about loud sounds, whether we're talking about, sirens going off and helicopters going off, traffic noises, you're talking about the overall, what we call the allostatic load, right, is happening on both the bodies. And I love how we can detect the same patterns in both. So the expression of that allostatic load is coming out in both. However, maybe the human is not taking care of it or paying attention to their own, and they may be taking care of their pet. And I know you have your beautiful animal behind you, Miai, and tell me a little bit about that relationship. Like, what does that relationship mean to you?
So Miai,
Mm-hmm.
of course, her name is My Love. I named her to be My Love. She is, well, obviously, she is my love and my fur baby first and foremost, but she definitely helps with like emotional, mental regulation, for example, in times of stress to help kind of ground me. And it's so funny because, it's funny that we talk about like, I've said that oftentimes if we see the animal feeling anxious, the owner is anxious. And it's honestly, and I've applied it to myself, in which I noticed because she gets really anxious when we travel and in the car. And so, what basically, I kind of pay attention to things such as those, in which if she's showing anxiety in the car, and then I start reflecting on myself, what am I doing? How are my energy levels? How is that kind of affecting her in the sense? And then I realized that I actually did have a lot of anxiety traveling because I'm like trying to get to the next spot. I want to be like making sure that I'm in there on time. And like, for example, when I traveled to San Diego, like you think, oh, I'm not really working, but I'm going to conference, that I shouldn't be stressed. But one of the things for me personally is that when I get stressed, I get canker sores. And that's what happened while I was in San Diego, which is really interesting because you wouldn't think that I would be stressed if I'm just like going to conferences, right? But the fact of the matter is my body was showing that I was actually stressed, even though I didn't think that I was stressed. But my dog, Miai, she was showing up and telling me in a sense that I was stressed because she was panting. She was anxious in the car. And so that's when I was like, oh, maybe there's more that I wasn't realizing that was happening. And then, for example, there's another great example. It was really funny because we're talking about this. So I reacted to whatever was happening in the environment. So she got kind of like not quite hives, but like bumps along her skin. And it's funny that it happened to her because it also happened to me. Like, I don't know where there were bites. And then I was breaking out. And then I went to like this head spa and they were talking about like, oh yeah, your skin's a lot more dry. But at the same time, we're a little bit concerned that you might have a little bit more going on, which is really interesting because she was flaring up and I was flaring up. So again, that like bond is a lot. That link, that neurobiochemical link that Gabor was talking about, is so much more present and stronger than I feel like we're aware of a lot of times.
Absolutely. You're co-regulating. There's such a word for it, right? Co-regulating. Like we're getting on that same wavelength, or when we're not on the same wavelength, noticing that we're not on the same wavelength. And I love how you're treating or taking the nature of what's happening to Miyai as kind of like an indicator to you, like pay attention, check in with yourself, what's happening with you, because had she not been there, you might have just walked around with your anxiety, just, in the headspace going, well, this is me. This is normal.
I'd be like, oh, maybe I just ate some spicy food or something like that. I don't know. I mean, again, it's like some people would be like, it's just coincidental or correlation versus causation. But it's just happened so many times that, again, that I'm like, this is very interesting. The timing, things that are happening.
The system that's involved, right? The skin
Yeah.
and the skin. And
Yeah.
and what I'm kind of thinking about too is that because animals are so somatic, they live in their bodies, right? They don't like escape out of their bodies into their heads like we do. Like that function that the bond with your animal can have of a way of bringing you back into your body, of reminding you you've got a body because your dog has a body too. It needs to be walked. She needs to be fed. It really reminds us that regularity of taking care of our pets can really remind us that, we also need care.
Yes. Oh my gosh. Yes. I definitely think I could have so much more stories in correlation, not just with myself, but like other people that I'm like, this is very, very interesting. And you need to start looking into your health because like just like how our habits can extend to like people, or how like when you start hanging around with someone long enough, you start picking up their mannerisms and their habits. I feel like that happens in a similar manner to animals, but more so because we literally are like the providers. We are providing the environment for them. We are the ones changing anything. So they are definitely influenced a lot easier than other people would be, I feel like.
Yeah. Yeah. It's like there's this kind of unseen network of meaning that's there if we pay attention to it. And we can kind of forget if it's even there because sometimes we get busy. Speaking of some of these common invisible things that harm pets that owners don't even realize, what do you think people do kind of, subconsciously or unconsciously that may end up harming their loved one in that way?
There's a few things. So the first thing that kind of, that bumps to the top of my head, one is the anxiety component. So like being high stress all the time, whatever workload it be, whatever they're doing, I don't think they realize or are aware of how much it does influence their well-being, their fur babies, I like to call them well-being. The other thing is like nutrition is, just like how nutrition is becoming a big component in a lot of things that we're finding in integrative med and mental health. It's very similar to the dogs, for example. And I'm not talking about mental health because that's not as much studied in animals, but I'm talking, for example, like just one example is like being overweight because, a great majority of Americans are overweight. And again, their habits extend to their dogs. So oftentimes I find that, if they're overweight and unhealthy, this has a tendency to kind of extend to their own fur babies and affect their own health. And a great example is when Miyai, for example, I have her in a healthy weight, a perfect weight, but by others, they think she's skinny, but that's only because like compared to what they're used to, they think it's actually skinny when it's actually a perfect weight because in comparison to other dogs, her actual breed, they might think that she is skinny compared to their dogs that are overweight. But that's only because their habits also has led to them to being overweight.
Yeah.
And so it's just little things like that
Yeah.
I've seen and I wish people were more aware of.
Yeah, absolutely. So there's invisible things, those habits, those, whether we're up, watching, couch surfing, not couch surfing, but just watching TV and snacking and then the dog is snacking and we're up late and we're not getting enough sleep. And and those kind of things where if we would look, so it's kind of like your pet is a reflection of your life back at you. What signs should pet parents look for if their animal is absorbing or reflecting something bigger?
So there could be a few things. And one thing, for example, is just like one example that I like to make is that if it's not something normal for them, but is happening to both them and their animal. So let's say, for example, well, I'm going to make me and Mia an example as well, because this happened not just when we went to California, but when we went to another place in where I was working as a relief vet. Both her and I were reacting to the environment. So not just me and her, the patients that I was seeing at in that clinic, I have never seen as many allergies as I've had in that space than I have had in any others. And so it's something that you have to be aware of. You can't be like you might just say like, oh, there might just be allergies. But the fact is in the clinic, almost every single day I saw 3 to 4 dogs with allergies. And in general, that you can see that in general practice, but it was way more so in that clinic than I had seen in other clinics. So it's things like that that it's just being aware.
Yeah, absolutely. I
Being
agree.
aware is like what the big thing to
Yeah.
do.
And seeing that something is falling out of the usual pattern, I remember in pediatrics, depending on the time of year, depending, you're right, where the clinic is, who the population is, seeing certain patterns and making a deduction about it to say, oh, it seems like this virus is going around, or, oh, there's a lot of allergies of this kind and it's this time of year. However, that begs the bigger question. I think what we've seen also is that more and more we're seeing more people reacting to their environment. We have more toxic stuff. We have more environmental reasons to be reacting to. And I think both children and pets, as we know, are more sensitive because they're closer to the ground. And they put everything in their mouths.
Yeah.
Right. So they're
Yes.
right. Like so there's like a correlation
Yes.
there between children and pets, which I love. And so, I want to kind of turn it around because, some of this, and I think that's what resonated when we were talking. I was like, we look at mental health in the West as like a very individual disease, right? We're saying, well, it's the person. That's it. There's something wrong with your serotonin receptors or your balance. And that's the old model, right? And the new model is actually it's a system. You are embedded within a system. Within you is a system. Your mind body is a system. Your gut is the system that's interacting with the outside. And then you're in your family system, and then in your household, and then your neighborhood, and so I think this topic really brings us to this awareness that well-being is something kind of that encompasses more than just the person, right? Especially in this mental health field. So let me ask you this. Is it possible that healing ourselves can actually help heal our animals?
I do believe in that is because, like there are so many things that we are not aware of that happens all the time. So for example, I was just looking through like research earlier about, being affected by either moods or being around other people. So like being able to I think that really honestly the biggest thing is being aware because for example, one of the studies that I had found like, oh, if you are just around another high performing person, you could potentially even increase your performance by a certain percentage, or if you're around an underperformer, you could decrease by like down to like 30%. So being able to be aware of the environment around you, what's happening, just like how I was noticing my dog's anxiety. Or, for example, there's another example in which I was working and one of the guys, the patients or clients that I was talking to, and I'm looking at the blood work of this animal, and I was worried about this cat being hyperthyroid. And I mentioned it. And he's like, that's really weird. This is now the third cat I've had that's hyperthyroid. And while I'm like, oh, that's very interesting, I didn't get to go into the details and nuances of that. But I'm like, maybe you just should start looking into what's going on around you, because 3 in a row with hyperthyroidism, yeah, and it's very common in older cats for sure. But it's like, is there something more that's going on? Or like if you have asthma and your cat has asthma, it's like, okay, maybe you need to start looking into what's going on into your environment
Yeah.
and what's causing all of this.
Yeah.
So those are the big things that I would consider.
Absolutely. And you've been in veterinary medicine now for over a decade in different kind of settings, emergency as well as outpatient. And, how has your view on animal illness evolved with experience, from when you first came in to this field to now?
My view on animal illness. So before it was, of course, as what was that saying? The more you learn, the less I feel like I know.
That's it. Are you there yet?
I definitely am there. And I'm just like, when I was an assistant, I was like, oh, it's so simple. Like, why isn't it just like this, and that? And then as a doctor, I'm now like, oh my gosh, there's so many factors. There's so many things. There's so many things it could be. Like, it's definitely, while it could be explained in a simple manner, there are definitely complexities to it
Yeah.
that you'd have to think and know a little bit more. And then the more that you know, the more the deeper that you get into.
Yeah.
So yeah, that's essentially how my journey has been with animal and their illnesses.
Yeah. I mean, I can just see that, like no two cases of asthma are the same. Each person
Mhm.
and each animal or diet is in their context. And it's really interesting when we first come out into practice, or, we're kind of starting to see real world medicine and how it contrasts with, the frameworks that we've learned, and kind of being like, oh, okay. Now tell me a little bit about how the intuitive self-defense worked into animal health for you. I want to bring that in because there's a lot of different threads here. And I think
Yeah.
we're circling around the well-being of both animal and human, and recognizing that, there's more information there. And if we would just put it together. And
Mhm.
so tell me a little bit about how you came to judo and what it's done for you.
Yeah, so I believe everybody has the gift of intuition, whether you think it's gut instinct, whether it is like a sixth sense, all those mean the same thing to me. And so the one thing that you learn in self defense, right, is being aware and being present. And that is essentially tied to the same thing in application to being a doctor, because you can't just be narrow minded. You can't just be like, look at this animal and be like, oh, it's this disease. You got to be aware of all the pieces of the puzzle, if you will. And like, if there's something that doesn't feel quite right, that fit, and it doesn't fit that puzzle, you more than likely are right. Even ones that people that I've worked with, they will say like, oh, there's just something off, or there's just something that's not quite right, or it just doesn't quite make sense. And the way that they follow it, and when they do it, and usually they end up being right. And so I kind of apply that kind of, I would say, like intuitive self-defense, because that's a part of it is being grounded, being aware, being kind of open and sensitive to everything that's going around you, in the same kind of application for animals, because I believe, and I do apply those same kind of principles when I look at it and kind of do an exam on at an animal or a patient of mine. Because, like, let's say, for example, I have like a cat that's really young and has a specific disease, and I'm trying to figure it out. But I'm like, well, all these things can point to a specific direction, And however, if it doesn't match and I feel like something is off, I could start to explore the other direction. And I can oftentimes actually be right. And I can't quite give a explanation for it, if you will. Maybe you'll like kind of like wove into the neurobiochemicals that it's linked somehow, and all my senses just coming together to put the pieces of the puzzle together.
Right.
And that is how I use, especially coming from judo, because in judo you have to be, aware with your balance. You have to sense where your balance of your opponent is going. You kind of have to develop a sixth sense of where the attack is coming from so you can counter it. So it's very similar to medicine, in which like you have to be aware of what's happening right now with your patient, like how they're doing. You kind of, but then like a simple change, you'd be like, oh no, we're okay. Like, where is this going? Do I need to prepare for something more? Is this the medication or treatment have to be changed? So it's like, while they might seem separate and like not applicable, I can actually apply a lot of those same principles to animals.
Wonderful. That's such a beautiful description. I really love that, because I really see that. Yeah. The intuition, when we talk about intuition, it's contrasted with our rational mind, right? But we also talk about this neurobiological chemical system. It's this whole mind body complex. And so there's messages, there's our gut instinct, there's things that are constantly, we're getting messages through. It's just sometimes our mind kind of takes over and is so much louder, right? And we only believe things that we can rationally,
Yes.
see, feel, hear, touch, smell, right?
Oh my gosh, yes. Like so many times, like you don't like understand. Like it's just like you say, because there's so many times in which like I don't have a rational reason for what I feel like I should, like. For example, there was a cat that I had that was in oxygen, and I think it had pneumonia. And like I remember looking and thinking of this cat and seeing the signs. I was like, do you really feel like we should start adding on antibiotics? Because I'm a little concerned that this cat will start becoming septic, which is or in the SIRS, so inflammatory phase, very severe inflammatory phase. And I'm like, and it's not, it's actually kind of, it's pretty uncommon for a cat to have pneumonia. To have them go into an inflammatory phase like that is even less common, and it's, at least in my experience. And so I was sitting there. I even asked my coworkers. They also asked other people. And they're like, it doesn't make sense this time. But I'm like sitting there. I'm like, I am really worried that's what's going to happen. And I can't explain it. And I really wanted to put it. But because I was an intern at that time, I was like, okay, I'm not going to do it. And then the next few days, lo and behold, they ended up putting antibiotics on that cat. And I was like, oh my God, I should have. I don't know if it would have changed the outcome, but it's stuff like that.
Yeah. And learning to trust that, right? I think what you were getting at is that through the practice of judo and through the practice of listening so closely, being sensitive to those nonverbals on that instinctive level, I think you've honed that instinct, that intuition. And when it comes up, it's ringing some alarm bells, but there's no verbal correlate for it, because the books tell you cats don't get, so sick with pneumonia. And even though you're seeing the systemic inflammatory response syndrome happening in front of you, it's not gelling with what everybody and you have read in the books and learned with your minds that this is how it's supposed to go. So I feel like we're in this place of even discussing like, yes, we've learned a lot of things, and then there's reality. And when the two are in contrast or not we can't reconcile them, it takes a lot. And I think what you're describing is that you were, early in your career, you weren't experienced, you hadn't really learned to trust your intuition yet. And so, but you still felt it, right? And now with time and giving yourself permission to be like, yeah, and the confirmation that you've had is it's okay to trust your intuition. And actually your intuition can be right a lot of times. It's such a big kind of piece here.
Yes.
So
And
Yeah. Yeah.
it's just like, I believe people actually rely on, they might call it their gut instinct, intuition, sixth sense, whatever. I believe they rely on it more than they realize because, like, so many times I hear, whether it's from people I work with or my supervisor, like, God, it just doesn't feel right. It just feels there's something more. And they're like,
Yeah.
so they go exploring and then they end up,
Yeah.
either figuring it out or not figuring it out.
And I want to also make that distinction because as we're talking, I'm like, well, what's the difference between intuition, let's say, that voice in your head that says, wait a minute, have you thought about this? And the voice of anxiety. And I know we didn't prepare for this, but it's like, is there a qualitative difference there that we can kind of be like, yeah. And because it's two different things we're talking about. One is like,
Yes.
you're getting quiet. And the other one is it's getting noisy, maybe,
Yes. So I have done a lot of work to be able to distinguish what is, let's say, my intuition versus what is like anxiety. However, okay, I'm gonna first go into that part because I know myself and I know when I am anxious and what causes my anxiety and what can put me in an anxious state. I can tell when it's like my intuition slash gut instinct slash sixth sense versus, oh, this is actually like, oh, a past history, if you will, where I had the same cat present for the same thing and now I'm just anxious because I think the same thing is going to happen. So I like being aware and being grounded, knowing myself, knowing my history, knowing why I'm feeling all these certain things definitely can help separate whether it is my intuition versus, anxiety. However, I do believe to a certain extent that the anxiety can kind of help in part of that link to your intuition because, like, I believe your intuition can help link anxiety, like kind of an alarm bell, if you will, telling you, like, maybe you should be concerned about this. Maybe there's something more that you really should be thinking about. So that's where, like, again, you'd have to be very aware and very present and very, like, know really who you are, your experiences, and your emotions to be able to differentiate which it is. Sometimes it's really hard. It's really hard sometimes. You're human, gonna make mistakes, and then you just learn. But then other times when you're able to, like, hit write the nail on the head, then you're like, oh my gosh, like, I was right this whole time. I'm so glad I listened. So
And thank you. That's such a kind of generous response because it's not always either or, and it can be both. And I love how the anxiety can be like the first kind of wake up call to be like, hey, you're ignoring something. Maybe it's just a louder alarm bell, right? Intuition's kind of a whisper, and the anxiety is kind of like, wait a second, we whispered. You didn't listen.
Yes, exactly. Yeah, I love how you said that. Exactly. Anxiety is like, hello.
Hello. It's like rising up, and then that's just this beautiful system we're in, right? And I love how
yes,
I have a patient, for example, who is doing some therapy with a horse. And I know that this is something that kids and people who really are struggling with anxiety, when we're with this gentle, powerful animal, like what is happening to us, right? Do you have words for that? Because I'd like to just know what is the basis of that? Mm-hmm.
Horses, first and foremost, are prey animals. They are highly sensitive to their environment because they have to be, because they are prey. They have to be able to be aware if, like, a tiger or a cougar or whatever comes running after them. And so, like, while we are in awe of horses because they're beautiful, they're majestic, they like have all these musculature, they literally can trample you if you want. But we also have the capacity to be able to befriend them and, have them be able to ride them in such a way that I think is beautiful, that they allow us to, by the way. However, people learn, so this is how I've heard, I haven't personally done it myself, but I've heard how horses can heal people is because people cannot come and either an angry or upset or like chaotic energy, if you will, or state of mind when you're near horses, because horses are so sensitive because they are prey animals that they will pick up on that and they will more than likely not allow you to be around them. So that's where, like, I think where you're saying the co-regulation comes in, because there was also a study before I was looking into about like horse rider and like their heart rates, and they were able to like co-regulate together essentially. And that's where horses can really help humans and their like mental and emotional capacity. And that's where a lot of people are actually helping like use horses in that way. Because like in, for example, in the integrative med conference, I believe there was like even a ranch that literally used horses that was handing out flyers and brochures to help heal like people that were abused or like addicts and whatnot, because you really, really have to have presence of mind and to have a calm, grounded energy. You cannot come at like those forces like that because they're so sensitive. It's very similar to like dogs, like scared dogs, fearful dogs, or like any aggressive dogs, animals essentially that are very sensitive. You like cannot come at them. And there's a reason why specific animals are more aggressive to other people versus more calm around other people. So it's kind of that similar mentality or frame of mind.
Yeah, thank you for explaining that. I really love that because, we get forced, right? And I think in all of this practice, in all of this, psychedelic medicine that we're doing, integrative medicine, there's this place where we get to where there's a point where you realize like, oh, it's the ego. It's my monkey mind. It's my anxiety. It presents in these ways. But when you're next to a majestic horse that can also trample you, if you don't pay attention, that really recruits the kind of survival instinct also into being like, right? So you're kind of dealing with maybe the kind of balance of the two, how to stay within, presence, attention, but from a place of alertness, because you're also having to move with. And I think that's maybe a network that we don't use very much. Our networks are very much geared towards kind of, I'm just in my head and I'm projecting everything that I think the world is outside of me. And anything that comes in from reality that doesn't match with my prediction model, I'm just going to let it go. I'm just going to go with what does match my prediction model, right? And that's one of the ways I feel like as a society, right? We're all going into comfort. What feeds, and staying in that mode. And what a beautiful kind of like reminder that we can come out and that our animals, when we meet them, like what I loved about coming home to a pet was you're immediately in presence. You have to be present. You can't be scrolling, and like in your own head. Because if you are, the dog's going to just be like, what the hell, dude? I'm waiting for you all day. And you can't play with me. You can't even be bothered to show up. And that does something to the bond, right? You can feel that. And
yes. Like even something simple as like feeding yourself, because sometimes I get so busy, and then Mia is like, she will completely let me know if I haven't fed her. She's like, digging at my bowl. I was like, oh, gee, I haven't fed you yet.
Right?
It's just like simple things like that.
Yeah. And just that kind of just, and we need that. I think that's another thing is like, we need reminders of that in our everyday because our lives have become so kind of frictionless in some ways to allow us to just stay in that spin. I'm going to, as we're kind of getting towards the close, a couple of questions. What's a small shift every pet parent could make to support their animals' well-being today? I want to leave our audience with kind of like pearls that maybe you've learned about from your experiences that might help them.
So like small shifts, because, I keep coming back to, if you will, like the anxiety, for example, because I feel like, especially nowadays with how everything is turning out, I'm willing to bet everyone has anxiety, even me. I try not to try to be grounded, but I'm sure times that I have to be like, ground myself. So just being able to be aware and have practices in place that can help kind of settle down like your stress levels so that indirectly, your fur baby can also calm down
Yeah.
as well and not have such a high stress level because we know that having high stress levels is not good for long term. It can cause to eventual other diseases if you continue that. So it's literally just, it could be just unplugging from your phone and not having that as the first thing that you look at in the morning, or it'd be going out in nature, or it could be literally, whether it's journaling, whatever it is that helps you bring back to yourself. It could be art. It could be me like judo. For me, it could also be dancing. It could literally be playing with Miai. Those are one thing that can like help in general. And hopefully you will start to see the effects of it as well in your dog or your cat or whatever animal you're with. And then I think even just one big thing I feel we really should look into a little bit more is definitely like nutrition because, integrative health, we've learned so much about how nutrition plays such a big role in human medicine. And honestly, animals, there's some nuances and differences, but there's so many things that we are also very similar to animals. Because I literally say that we humans are also part of the animal kingdom. We file ourselves under the animal kingdom. And so nutrition is also going to be very important if you really, it's simple but consider it. Don't feed, like junk food all the time. Don't feed like all these things that the dogs are not supposed to be eating. Be a little bit more aware of what they're supposed to be eating, or even just the portions that they're supposed to be eating, because some people are like, yeah, I just give them as much as they eat and I don't know how much I feed them. And I'm like, okay, well, maybe we start quantifying how much they're actually eating, because they're kind of, they have a little loving is what I like to say to them. And then just being aware a little bit more about like things that like patterns, if they're able, because,
Yeah, makes me think of something. We're talking about this kind of time that we're living through where our food systems, our water, our soil, our air, we're much more aware of the ways in which the contamination of these, are impacting us. And we're seeing these diseases like lymphoma and chronic illnesses more and more in pets as well as animals, right? So, I'm kind of just really reflecting on the fact that what's happening to our animals, like you said, we're part of the animal kingdom, is happening in our bodies, and I'm always drawn by the fact that, if you show Americans mostly, but people, a picture of a puppy in pain, they'll be like, "Aw." But if you show them a person in pain, they'll be like, "Yeah, okay, fine." There's like this greater sense of empathy that we have for our animals because we feel responsible towards them and we know that they can't help themselves. And so, if there's anything in this episode, that you're kind of, as you're going forward in your practice and, you're just starting out kind of in your career here. And as you're looking forward into, like what's happening, what kind of diseases are we seeing? What kind of, like you said, like the books are no longer start explaining what you're seeing in your clinic, right? Like there's new patterns that are showing up that haven't even been investigated or given much credence. And yet we're all talking about the same things: lymphoma, multiple myeloma, diabetes, hypertension, cancer. It's happening in both. And so I'm really curious about, what you want to see happen about this correlation that we're living through. What would be the way through? And I don't even know if you've thought about this, in that kind of overall way, but we're all in the same boat here.
Yes. So Honestly, I feel like what comes to me when, you ask these questions in terms of like animals and humans and the bond and like the link and everything like that. I feel like the more people are aware and really start believing that all the things that they do can affect everything around them, I think we'll start changing not only how we interact with other people, how we treat with other people, but also literally like our earth, our animals, and treat each other, if you will, a little bit more, for lack of a better word, sacredly, because we are so interlinked. I believe we are so interlinked in ways that we don't always understand on a like scientific and evidence like level. But like the more that we understand it, I feel like the more we would really, you know, put in the effort to taking first and foremost care of ourselves.
Yeah.
And then by extension, because we care of ourselves, we take care of our animals, we take care of the earth, we take care. So then everything, it's like a domino effect or snowball effect, if you will. And I believe more and more people are being aware of this. And I'm honestly, like, I know the world right now is kind of like into chaos, but I like to think of it as like, oh, you gotta like put down the like tear apart your like funky foundations first, the ones that are like cracked and like terrible and diseased before we can build the right foundations, the strong foundations that can last us a lifetime and more. And so I'm like, honestly like, yes, nowadays, a lot of stress, all of this. I totally recognize that. But at the same time, I am pretty excited about what the future can bring because I feel like more and more people are aware in the integrative health space, especially and realizing all these things, whether it's nutrition, mental health, genetics, like women reproductive system. They're realizing, like miscarriages, all of that is actually really not the women, for example. And so, like, then the more empathy, more like kindness, and the more I feel like wealth indirectly of everybody will be, and wealth and health will be affected. And I am honestly I can't wait when science starts catching up and showing up all these links that I feel like are there.
Yeah. Yeah,
So,
absolutely. It's high time. And I
yeah.
think we're on the edge of that, on the precipice of that. Because what you just said is so, like, I think grounding is the sacred. It is the sacred kind of recognition. I feel like you expanded upon the fact that if we can recognize that this bond is real, that we are one thing, right? That we're all in this one thing. It breaks down our kind of ego strength, ego system of thinking ourselves as separate, which is part of the loneliness piece, right? It's like when we can find ourselves so like, oh, well, I'm this and I'm not that. But if I can say, look at my pet's face and go, I'm you, you're me. Like we reflect each other. You go through the same things I do, and I go through the same things you do, and we're in this
Yes,
together, right? Our food,
exactly.
our water, our air is all
Hmm.
going to have an impact on us. And I care about you, and I want to care for both of us, right? So it's this beautiful way for people who've not had the experience of being cared for, or that attachment, that caring has been traumatized in some way or not been given. I think what we find is that heals something within us when we can care for something and it cares back for us, right? I've actually heard somebody say that even when you take away, like somebody who was in prison, right? Even when you take away everything, your family, your job, your every single indicator of who you are, a human being will want to care for something. And even in prison, these prisoners were caring for the ants because you're not allowed any pets. They were caring for the ants. They were bringing little food. I mean, just that, right? Like that humans, we want to care. And that's how we find our humanity is in caring. And I really love how this conversation has really expanded upon us this idea that it is sacred, not just because we believe it's so, it's because we're sacred and what we're in is sacred. And if we don't take care of it, take care of all of it, it's not going to be there for us, you know?
Yes,
Yeah.
it's not. If we don't, don't take care of things, definitely things are gonna fall apart. Just like, my hip. Just
Right. Well, let's
Wow.
tell our audience how to find you. So where would you like them to connect with you? And then, whatever you'd like to say to our audience.
Yes. So, I have my Instagram. My handle is Dr. Nadine Sensei because I'm a doctor, and then I am also the black belt in judo. And then I do have a website I just put up. It's under construction, so you're gonna have to forgive me, but I'm very excited. I just put it up today. It's intuivet.net for my veterinary things, but I also have Mind, Heart, and Body Dojo. But Dr. Nadine Sensei for my Instagram and intuivet.net.
Okay. And that's doctor with a DOGTOR. I love that.
It was Dr. DOG. Now it's DOC, actually.
Okay.
Yeah.
So changed
DOC.
over. All right. Well, Nadine, it's been a pleasure. Thank you so much for giving us your time and your heart and your expertise and your just ability to sit with all of that and just this lesson in trusting yourself, trusting your journey, and trusting that you're on the right path. Because I felt that when I met you. I think you're on the right path, and it's all beautiful. Thank you so much.
No, thank you.
Thank you.
Thank you for having me. I
It's been
appreciate
wonderful.
it.
You're welcome.
Love our talks.
Thank you.
Thanks for joining us on the Two Curious MD podcast. We hope today's episode inspired you to ask new questions and explore fresh perspectives. We challenge you to ask us those unasked questions that you're curious about in your medical practice, condition, health, and wellness.
If you enjoyed the podcast, don't forget to subscribe, share it with somebody just as curious, and leave us a review. It helps us keep the curiosity alive. Post or comment with a question or curious inquiry that you have and seek to explore or learn with us. Stay curious, and we'll see you next time.